Just for the sake of time, I'm gonna thank you. Go ahead and get started. Again, I want to welcome you all to the Logan. Why am I trying to sing? I cannot sing at all. Hey, Danny, thanks for jumping on. At all, but for some reason I'm singing words out. Very strange. But I am Jeanette Davis. I am the community health specialist for recovery supports in Logan and Mason, ROSC. And I thought, I know most of us know each other, but I just would love to go around, and Grace, maybe you can help me make sure I don't miss anyone, because I can tend to do that. But if I can start with Grace and share who you are.
Yep, I'm Grace Irvin. I am a prevention coordinator with Chestnut Health Systems, overseeing the prevention and recovery grant.
Awesome. And you will see more of Grace as I am out on maternity leave to kind of continue to help walk us through. I should be, as long as she cooperates, here this month or excuse me, October, but November and December for sure I'll be away. But thank you for your support, Grace. Leanne.
Yeah, hi guys. My name's Leanne Corson. I am the Region 3 ROSC mentor, and I'm just over here busy celebrating Recovery Month.
So, Miss Nadia.
Good afternoon, everyone. My name is Nadia Camp, and I am the Director of Integrated Community Education here at Chestnut, and I get to oversee all these awesome things happening in Central Illinois, from prevention to recovery, and Logan Mason has a special place in my heart. So thanks for letting me be here.
Awesome. Miss Abby.
Hey everyone, I'm Abby Behrens. I'm with Brightpoint and I work with the Butterfly Project. Yeah, happy to be here.
Glad you're here. Sammy.
I am Sammy. I am a person with lived experience. I am a certified peer recovery sports specialist. Almost-ish. I ain't got my certificate yet, but I am. And I'm also a case manager at Chestnut Health Systems in Bloomington.
Yes, ma'am. Glad you're here. Miss Molly.
Hi, I'm Molly McCain. I'm the community health coordinator at Lincoln Memorial Hospital. So that's a little bit of a role change. I am now the point person for your Logan County needs. So
Awesome. Congratulations, Molly. And we're so happy to be working with you. Cassie.
Hi, I'm Cassie Delaney. I am the project director with Memorial Behavioral Health.
Thanks for being here. Miss Amy.
Hello, I'm Amy Hopper. So I work for behavioral health at the McLean County Health Department. And then like Jeanette shared earlier, I live in Lincoln. I'm from Lincoln. Also lived in Mason County, lived in San Joe's for about 15 years, unfortunately. But that's a different story for a different day. Yeah, so I've been joining this group just as I've been working with Nadia and some others from Chestnut on the health department becoming a DOPP. And so interested in some of your models.
Awesome. Thank you for being here, Amy. Danny.
Good afternoon, everyone. Oops, sorry, that's my phone. I'm Danny Sorvis from DuPage County ROSC, and I'm just here to support and observe.
Awesome. Thanks for joining us again, Danny.
Thank you.
And I see someone just jumped on. Shelly. Oh, I don't know if she can hear us. Does anyone? Shelly, would you like to introduce yourself? Oh, you're on mute.
I think she needs to connect her sound.
Okay. We're thinking maybe your sound isn't connected. Well, we'll let you work on that, and when
maybe she can use the chat function too.
Sure. Yeah. If you have availability to the chat,
You can click on the chat, then you can do that.
thank you,
she's
Cassie.
connecting now. Look at that.
Okay. Awesome. Hey there, Shelley. Can you hear us?
I can finally hear you. Thank you. I'm so sorry. I'm having trouble getting this. I'm not really, yeah. Anyway, so yes. So thank you for allowing me to join your meeting.
Awesome. Shelley, can you tell us where you're joining us from?
My son just passed away 3 weeks. It'll be 3 weeks tomorrow. He had mental health problems, and I am starting a mental health awareness. What I want to do, excuse me, is basically take people. I want to provide transportation to people in the Mason County area to go to facilities when they have mental health crisis.
Wow, Shelley, I again send my wow, that's a lot that's happened just in a short amount of time. And the fact that you're here joining us on a mission, I'm so glad you're here. How did you hear about us, if I can just ask you?
I went yesterday and spoke with the LCSW in Havana, and she gave me your information, and and I just I want to get involved, and I want to do something good out of something really bad.
Wow. Well, we are honored for you to join us, and we want to walk alongside you. So there are some momentum happening in Mason County and Havana. So glad you're here, because that is definitely an area we want to beef up. So
good.
Yes.
I'll do what, you know what, I've already started a nonprofit organization. I've got like a couple of my son's best friends. We are we've got some stuff going on, and it's just really I'm just really excited, and I just want to know what else is out there that we can, partner with, that they can help us and we can help them.
That's incredible, Shelley. Well, I feel so honored that you found us, because this is exactly what our heartbeat is about. So so glad you're here. All right, well, we're going to go into our presentation here. There's just some information we're going to go over. Of course, welcome to our ROSC meeting, and just for ROSC, Recovery Oriented Systems of Care. This month is National Recovery Month. The month of September is a month that we do as a nation stop, pause, and recognize that recovery is needed, that recovery is possible, that recovery is happening. So just a big month. We know, as Leanne was mentioned earlier, she's been busy in her neck of the woods and kind of all over our state. Folks have been organizing and planning different recovery events for this month. So just wanted to make sure. I think it's important. There's so many months, and I know this month is dedicated to a couple other things as well, but just wanted to highlight so we're all aware. The ROSC, and just for Shelley and all those of us to help remind us what our ROSC is exactly that: coordinating and networking, helping services to get together with a person-centered approach, right? And so I'm not going to read it verbatim. I kind of hate it when folks do that for me, but it's there to remind us that we are trying to build in those strengths and the resilience, which includes individuals, families, and communities. It takes all of us. And so the ROSC is really committed and created to help connect those dots and really help a community move in the direction in which they feel is needed. So, and then just a snapshot. We haven't looked at this in a little while, but wanted to dust this off and bring this out and put this in the forefront of our mind. But our mission statement, improving access to health, wellness, and holistic recovery options for people who are at risk of or suffering from substance use disorders, while educating and connecting Logan and Mason counties to reduce stigma and improve recovery outcomes. And I just did what I said I didn't like, but I hadn't read it out loud.
No, can I say something?
Sure.
Okay. Well, my daughter, she's in recovery, over 6 years. She was a heroin addict, and she is a light. I don't know if there's anything, but she is just if there's any kind of, I don't know what you said, you're, highlighting it this month, but she would be I know she probably wouldn't want to speak, but she should speak because she has been at the depths of despair. She's lost her children. She got her children back. They graduated with honors. And now we're lost her brother and my son. So she's an inspiration to me. And I just feel like that maybe she could, she wants to be a part of this as well. But I just don't know what your plans are for September, but I would like to be involved with that if I can. And I would like to bring her just to show people that, there is life after addiction, because she's proof.
Absolutely. I love it, Shelley. And I can't say that more, that I just feel like you are at the right place at the right time. And we are just honored to have you a part of it, because what you're talking about is exactly the directions that we want to move, and we want to connect and create opportunities for exactly what you're talking about. So, yep, stay tuned. We have that information coming up, and I definitely look forward to connecting with you after the call too. So, I'm glad you mentioned that. So, if you've spent any time with us going through, I do want to pause and just sometimes fill our tank. We tend to be folks who operate in a community of giving and planting and watering and coming back around and following up. And sometimes that can get exhausting, or sometimes we forget. A little bit about that. It's with my quote, to accomplish great things, we must not only act, but also dream, not only plan, but also believe. And so just knowing that the weariness or the heaviness of sometimes what I call the responsibility I feel I have as part of this journey, but requires a lot of to do, right? Our to-do lists and checking this off and making sure that it gets done. But when we pair that with dreaming, with believing, with hearing these stories of overcoming, really helped to nourish us and continue to strengthen us. So I just wanted to pause and take a moment to fill our tanks a little bit and just remember. So speaking of Mason County, I do want to make sure that we know we have a newer support group meeting that started in Havana by these two gentlemen who happen to be people with lived experience, who are just from the area, believe in peer support, and have joined together. So Wednesday nights, and Shelley, this is something I don't know if you're aware of, but the Havana's Hope for Healing group meets at the Havana Park at the Pavilion right now at 7 p.m., 7 to 9 on Wednesday nights. As the weather changes, they will be moving into the rec center, but we'll let you know when that happens. But just a great group of folks that have started to get together and support each other. So they are available, and we will make sure to email out our minutes. So their telephone numbers are there on this as well, if anyone wants to reach out to them. The other super exciting thing that Grace was actually shared with me, is that the Havana Public Library is now going to be a safe space to have harm reduction products there. So they're available for free. Is Narcan, yes, fentanyl and xylazine testing strips. That is their contact information and their hours of operation. But correct me if I'm wrong, Grace, but they're going to have a space and a shelf dedicated to these items that folks can just then help themselves to what they need. And so this is a big deal, right? Those places that we know, those small towns that sometimes it's even admitting that we need something like this, or the local library has stepped up and has taken this on. So we want to make sure to be able to pass that information on to our friends in Mason County. And even too, I find that sometimes we don't know how to support these efforts. Maybe, you know, we don't live there in whatever, but even a quick email or a little blurb to the library to say, way to go, guys. You know, I think that's another way that we can celebrate each other and encourage each other as we come together on this mission. So just throwing that out there. But some great things happening in Mason County, and we definitely want to move in the direction of having our recovery walk, not just in Logan County the way we're doing this year, but also in Mason County next year. And we just see that these pieces to this puzzle is to continue to build and build some momentum. And so we look forward to that as well.
I'd like to add, like, this is like a super huge thing for Mason County. So it's like so exciting. But also it's going to be, I think, right when you walk into the library. So like, if people don't want to come up and ask for it, it's just right there for it. They also said that if we wanted to, if like anyone wanted to provide any sort of information, that they are more than willing to add it to wherever all of these things are going to be. So it's super exciting. I just want to throw that in there.
Nice. So like flyers for anything coming up or things like that, other services available. Awesome. Awesome. Well, way to go, Havana Public Library. And again, we hear through our ability to hear from other ROSCs in the state that public libraries are our little nuggets of goodness. Okay, so we just another encouragement to reach out. I know many libraries have displays for Recovery Month with recovery materials that are front and center and available. So just another contact and perhaps connection and community partner as we move through in your areas as well, to tap into them and see how they can be a support. All right. Update. So, as you know, many of you have was part of the conversation of our harm reduction panel. Narcan Saves Lives was the event that we had. And this is just a pic of those of us that were there, and just a little clip of some of the comments that were made. I can say that we have had over 1,000 views, and that is just from the data, right, that we have on Facebook, so from our site. So we know that it has been sent out via TikTok and Instagram as well, but you know, there's great comments, proud of you all. We got good feedback, but even this one where it says Stacia saved my brother one time, if it wasn't for her, he wouldn't be here. So in that same breath, as someone is watching and sharing their story, a person on our panel had saved someone else and they wouldn't be here, and acknowledging that and putting that together. So I just want to say that if you again wonder how, you know, how can I really help these folks, and how what ways can I contribute, sharing that what do you call it, that video could be a way into doing that. You know, we don't have to do anything major or, you know, crazy cost money or things like that for us to support and each other. So that's just another way. But it was a overall extremely successful event. Sammy, you were one of our panelists. Is there anything you want to add to this?
I don't think so. I think we did a really good job.
Yeah. Yes, we had people tune in. The other thing that we did that we didn't really highlight as we were planning together was that we did do a balloon release. And so during our time together, we gave people the opportunity to share the name of a loved one that they've lost during this, because we did hold this event on Overdose Awareness Day. And so we had our time to acknowledge those folks, to speak those names out loud. So that was a beautiful moment as well, that we had together. So just wanted to share. We look forward to expanding this event next year. Perhaps we open it up to an audience, as well as, a Facebook Live. We'll continue to build it up, but just want to thank everyone who supported us, who jumped on, people who I've seen share. So thank you for that support, and everyone who joined us. All right, so our upcoming Walk for Recovery. So this is what we are planning for Recovery Month. So Shelley, this is our recovery walk that we're going to have, and this will be held on September 30th from 1 to 3. It will be in Lincoln at Scully Park. We are going to have resource tables, and we are going to have time for a moment of silence. We're going to have speakers. We're going to have food and refreshments. We're also, of course, going to have a walk. It's not going to be a 2K, 3K, 4K, nothing like that. We're just going to hit a couple blocks, but making sure we're going to circle our courthouse and past our jail and coming back around to the park. Now, Grace, I'm kind of putting you on the spot. Do you have the list of who we have that are going to be there so far? Or is there anyone on the call who wants to be there, or who wants information that we can share on your behalf?
So the people on the call are going to be there is Molly and Cassie and Abby.
We already committed to the McLean County ROSC event that day, and we don't have the staff to cover both.
But you can leave us stuff like flyers and stuff. I can grab them from Patty.
Okay.
Yeah, that's what I was
that.
thinking, Abby.
Yeah.
I know we're kind of torn because McLean County is having their event same day, just from 5. It's their start at 5 in the evening. So I know it's difficult, but we would love to share any info you have, Abby, and support your efforts.
Yeah, we'll get that to Grace, but yeah, we just won't have an actual person there. I'm so sorry.
That's
No,
okay.
that's okay.
We still
That's
love
okay.
you.
We know that probation and Crime Stoppers will be there. We know that Oxford House will be there. So we definitely are going to have, like I said, resource tables. If you know of anyone whom should be there and they're just maybe not on our radar, or maybe we need to take some extra time and care and invite them independently, or see what the barriers are to get folks there. Those are things I'd love for you to share with us. We try to be as mindful as we can on who should be at the table, but we don't always always know. So that's where your input and your invite can help. So again, there is no that I have found better way to connect and really be part of the change by coming to things like this, right? By connecting with families, hearing folks' stories, and just making time. So that is still the Survey Monkey. Look, I'm having that open till the day of. If we can get people there, that's what we want. There's also going to be planning on having a t-shirt vendor there that is going to be making some t-shirts on the spot for those who want to purchase one. So be having more information about that. But so we look forward to a great event. Any questions?
I would like to
Oh, yeah.
Oh, sorry. I would like to come. I would like to come. This is Shelley, and I'm hoping that I can bring my daughter. I don't know. She works every other weekend. I'm not sure if she has to work that weekend, but yeah, I mean, she's got a testimony, but I don't know if she's willing to share it yet, but at least she has a very moving testimony, and I think that it would be good for her and I to go, and I think that'll help us heal from, I mean, the trauma that we're suffering from my son and her brother.
Yeah. Well, Shelley, this event is designed specifically to make room for the loved ones that we've lost. And so you will be surrounded by others who have had that experience. But you're right, the healing does come from each other. We are truly stronger together. And I'm so glad that you were able to connect here with us. And like I said, we are honored to walk alongside you. It's a very difficult time, but this is exactly where we hope you feel loved on as you're walking through this. So any other questions about, sorry, the walk? Anyone? The Salvation Army is going to be there too. Oh, let me do a shout out. So we were having some last minute uncertainties about where our pulled pork was going to be cooked at and this and that, and so we have to have that done in a commercial kitchen. I will say that the folks at the Huddle House in Williamsville have stepped up and not just allow us to take care of what we need to there, but the district manager wants to put together a basket to be raffled off on to support our efforts. So I'm just super excited to make that connection, and it's simply because my son works there and they're really great family business, and they were all about it when they heard and wanted to jump in and help serve in that capacity. So the Huddle House in Williamsville, if you pass by, maybe give them a try. All right. So I always want to remind, but not just remind, that we have a harm reduction vending machine in Lincoln at the Family Custom Cleaners. There too is available the Narcan, the fentanyl, and the xylazine strips. But we got an update of the stats, and so as of 9/13, 266 Narcan, 263 fentanyl strips, and 308 xylazine testing strips have been used from the machine. So that is incredible. I want to thank Grace for remembering to get those numbers. We've been wanting to report back because we know that it has been utilized in a major way. But wow. So two things. I said, one, it makes me sad that we need that much, but it makes me glad that we have it available. So what does that tell us? That tells us we still have work to do, right? That and that at the same time, people are utilizing the things that we're providing. So I feel like that's important information to know. And always I'm trying to make sure, the ROSC is adamant about trying to make sure we put out good information. So I pass by there, make sure they're filled up, and I don't want to send someone somewhere to receive a service that's unavailable. So I've just been really confident and happy to see how this has been going. So that's a simple referral to someone. And sometimes, again, this is the building's open 24 hours. And you just go and put in what you need. You don't have to ask anyone. So this is another discreet way. We've encouraged folks who have elderly parents or something who sometimes they forget and took a medicine and forgot and took another one. We just never know. So these things are available. All right. Our Recovering Action Group meeting, we meet the second Tuesday of every month. Shelley, this is something maybe too we can figure, right now we're only meeting in Lincoln, but we want to open this up, and this is just our Recovery and Action kind of subcommittee group. It's a group of us with lived experience who get together to do different plannings, and like planning the recovery walk and making sure that we get insight and information, and we're doing this as a partnership, not as just and so these are open to anyone who is available. Like I said, it is just in Lincoln right now, but we're working and hoping and figuring a way how, even hopefully in the beginning of the, or as the year, as we go into the new year, that may perhaps we'll meet quarterly in Mason County, to just find different avenues on how folks can to join us. But we'll be meeting October 10th at 4:30. And I'm happy to announce that Sammy, when I do go on maternity leave, will be stepping up in my absence for those meetings. So I love that. And she will help keep the motor running when it comes to our Recovery and Action meetings. So those will continue. Please share this. Please share this with folks. Anyone who wants to get involved. People are saying, I want to, I got time, but I don't know what to do. Send them here. You know, we would love to partner. Here are our flyers too. We got these in a 5x7 size card, as well as a business size card. If you are needing these, please let us know. I will get them to you. I've been trying to drop them off of different places in different areas, remove the old signs and put on the new ones. So, but if this is something that can use, if you have a care kit that you put together, or a bag of information that you give out to your folks in your community, please let me know so that I can get them to you, or even come help stuff some bags if it means that we can get a flyer or something, help get the information out. But these are our active meetings that are going on. That QR code will link you to other resources as well. So I want to make sure y'all are reminded of that. So we are going to do a SWOT analysis review together. So I know not everyone, awesome, Abby, I see you, girl. Thank you. Some of you were part of our SWOT review in the past, but one of the things that we really want to be mindful of is that we are staying on track with you know, what we have acknowledged, what we've noticed. And so one of the things that we did was a SWOT analysis. And so this is the one that we have put together in the past. Next slide. And so I thought that it would be a good time. So a SWOT analysis, right, is a breakdown of our strengths, our weaknesses, opportunities, and our threats. And so this is a list of what we've come up in the past. And I'm just thinking, going through these lists together and identifying, because I'm happy to say there are some things that will move from opportunities to actual strengths, right? But there are also maybe some strengths that may have moved into threats. And so, you know, just kind of keeping our eye on what we're doing well, what we can improve on, trying to be proactive of some things coming down the road, or maybe we have some solutions as a group already in the room that we can put out here. So y'all with me? We can go through this, right? We are going to go just through each category. So we'll start with strengths, and Grace is going to be helping on the backside of things to help take some notes. But do you want to help talk us through this a bit, Grace? How,
Yeah. So what we thought about was just going through like each of the sides, or each of the, I don't know, I can't go backwards. Okay, yeah. So going through each one of these categories, and then I'll throw up a big snapshot, and then we as a group can move stuff around to the correct categories that they belong to. And if there's something missing, please share so then we can add it to any of these categories. So the first one, strengths, so strong awareness of the need for expanded recovery services, committed ROSC council, passion and willingness for the work, compassion and understanding, desire to create an inclusive environment, strong foundation in the community, drug court, etc., collaborative spirit and desire to work together, inclusive of PLEs, a group of committed participants, participating PLEs, creating a space for folks to participate, some exciting movement towards expanding services and supports in the area, recovery and action subcommittee, funding available for peer recovery specialist trainings. And then weaknesses, we have no existing inpatient treatment centers or sober living options in our area, lack of public transportation options or support to people who are in recovery to get treatment, lack of access to support group meetings, lack of MAR services and wraparound services, resistance to facing the issue within the community, denial, lack of understanding or educating of addiction as a disease rather than a moral failure. Despite desire to collaborate, many providers and organizations remain in silos of service, limited financial resources, too small rural counties, limited access to harm reduction services. We need additional representation from PLE, lack of safe spaces to gather and feel supported. So opportunities are other organizations willing to partner / assist with action in Logan and Mason counties, SIU MAR program starting soon, push to develop another Celebrate Recovery meeting with open arms, technical assistance and free training from Faces and Voices of Recovery in Illinois, developing RCOs, Recovery Corps, contracted to provide services to the state peer recovery specialists, Heartland peer specialist apprenticeship, possible local option. Oxford House is looking at the area, providing potential for recovery housing, and government officials are largely aware and supportive of the need for increased recovery actions. And then threats, no end in sight for new cases / people who need recovery services, stigma around recovery and denial that there is a community problem, prior failure to deliver objectives or see tangible results from recovery efforts, or access to internet, cell phone service barriers using telehealth services, healthcare gaps and lack of mental health professionals. COVID has presented new challenges, gaps with in-person services, inadequate youth services, prevention and treatment options, lack of willingness to collaborate / resistance to collaboration. So, okay, I'm gonna share. 2 seconds. I got too many windows open. Where did I put it? Oh, here it is. Okay. Did it work? Yes. Okay, cool. So I thought that we would start with moving things to strengths. So if there's something that you see that should be moved, like I can like give an example, like Oxford House, like they have housing. So like this would move here, and then I'll change how wording is later. But if anyone else, I can make this bigger too.
That's helpful.
There you go. So just shout it out what you think needs to be moved to strengths.
And why we were confident to put the Oxford House is not only do we have a men's Oxford House of 7, they are filled. So that is extremely exciting. For me, just real quick, the SIU MAR program is definitely on and popping and being utilized. Actually, I was in Springfield the other day, and I believe that I saw Dr. Dunkley on a billboard for SIU.
Yeah, she is.
Right? That was her, right, Cassie?
Yeah, it says doctor, advocate, and something else. Yeah, it's a good picture of her.
It
That's
really,
awesome.
really is. It really
Do
is.
you have the Phoenix House? Do you have the Phoenix House down?
We definitely have some of our allies at the Phoenix House, yes. But the MAR or medical assisted recovery services are available at the Logan County Health Department. So those that are in seek of those options now don't have to travel to bigger cities. And so folks are actually traveling here. Even smaller town, rural areas are coming to Lincoln to access that. And so we want to make sure that Mason County is aware of that service as well.
Mason, or excuse me, the Phoenix House, my son was tried to commit suicide 12 times. And they sent us to the Phoenix House to get Narcan. So they give you Narcan. I don't know if the Narcan is available for free everywhere, because this is all new, but that was a really good thing for us to have. I mean, we never used it. We should have. Well, he wasn't living with me, but I'm just saying that they offer Narcan for anybody as much as you want for free.
Awesome.
Yeah, that's a huge.
And you said that was the Phoenix House?
The Phoenix House in Springfield, yes. Yeah, Memorial Hospital was the person that told us to go there.
Yes.
Their advocate.
Absolutely. Absolutely. Awesome. What else, y'all? What do you see that we can move into our strengths?
The lack of public transportation, because that's really what this nonprofit organization that we are trying to get. It's going to be we've got the name. So far it's TWA mental health. It stands for Trenton Wayne. And I don't know, they just keep changing the name, but anyway, we are going to get a van, and we are going to start being able to transport people from the Mason County area that are in crisis and take them to these facilities, whether it's Springfield, Bloomington, Peoria, whatever. And I'm sure you're probably already aware, OSF is building a new 120 bed mental health facility, and it should be done hopefully by the end of 2024.
Awesome. So I think too, perhaps the lack of transportation, maybe we can move it to opportunities.
Yeah, that's a better place. Yeah, you're right. Yep.
That's great.
Perfect.
That's great. So as we continue to build that, and I love that, but that opportunity is on its way. And again, you taking the pain, right, that we feel, and moving it into action, and creating pathways for others. It's incredible. I cannot say that enough.
Thank you. Just want to do something good, because he was just too fabulous to just let it go.
That's right. That's right. What else? Is anyone seeing something?
Wouldn't limited access to harm reduction services be moved?
Yeah, that definitely needs to move over, because we have great coverage, and to know that we have an accessibility in Mason County too we didn't have is incredible.
What about Celebrate Recovery meetings with open arms? Because that's happening, right?
That is happening, and that is an ongoing, regular event that they are getting traction and momentum. So that too, yes.
Hey, Jeanette, I know I'm not a part of your community, but I work with you a lot.
Yeah.
Aren't you guys, wasn't there like a space where meetings are starting to start at? I was looking at the lack of safe spaces to gather and feel supported. Isn't there like a big place that's turning into like meeting places?
Mm-hmm.
So maybe that could be an opportunity.
Absolutely. I was hoping that someone would mention it. Leanne, you're on it. So because I was watching, I talk a lot, I'm trying to, but yes, for those who don't know, there is the 5th Street project that has been going on for over a year now. And the goal for that space, that is the old St. Clair's nursing home that we're all partnering, working, and trying to figure out a way to create emergency shelter, transitional, perhaps even long-term, as well as providing services like Carl being in the building and offering the services there, as well as Salvation Army. And right now, the first tenants that are already there are a group that are calling themselves the Lincoln recovery groups. They're holding NA, AA, and CODA, Codependency Anonymous meetings there currently. And the hope is that building continues to develop, that yes, we will have more meeting spaces for peer support, perhaps internet access to folks who may be seeking employment, and those kind of things. So yes, that is certainly an opportunity. And oh, I understand. Thank you for popping on, Danny. I see that people have to go. I get it. The one thing I will share is that these are recorded and on our YouTube channel. So even if you can't say the whole time and you want to catch the end, or you know someone else who might have some insight into this conversation, you can share that link with them too. That would be helpful. Yes. What else can we move around here?
Wouldn't the no existing inpatient treatment centers and sober living options in the area move to opportunities because of Fifth Street?
Nadia?
I think they can be split out.
Yeah.
It's rather challenging to get a new super license and to get a super licensed facility to house inpatient potentially. So that it is what it is. I don't know that we as a council have the ability to impact that, but identifying other additional sober living options, especially, I mean, moving Oxford House is a huge one that they have a presence, but the expansion of additional sober living opportunities could be an opportunity.
Yep, that's exactly right on. Cool deal. Thank you for that clarity. Because yes, in the same breath, we're like, yes, there's this men's Oxford House, and it's like, and where's the women's, right? Because we have women that, so we know that we got to continue to work on that. Let's see. Anything else that folks see that I do want to mention, I guess, out loud as an opportunity to remind folks too about Recovery Corps, that they are an option and can be even a pathway for organizations and agencies to get extra hands and feet, as well as helping that individual to earn their credential. And so it really is a win-win. So just wanted to throw that out. Recovery Corps is just it's another option.
Anything else anyone sees to move from any category to another?
Right.
Or they see something that's not up there and that they would like it to be added.
Well, I think, as we're looking at this, oh, yep.
I don't know if this is an issue or not. I would imagine that it probably is. The patients that need to get into facilities, some of them don't have insurance, obviously, and I'm just going to be honest. I know this from Mason County. It's a terrible thing. There are some of them are illiterate. And that's one of the things that I want to do in this, wherever our hub is. I want to be able to take those, because I've been I've worked in healthcare for almost 30 years, and I can help them because I want to give them some power to be able to, because if they don't have health insurance, that's going to change their whole trajectory. You know, some places will take them, some places won't take them. I don't know if that's on those, but I feel like that's something that's extremely important. And I mean, I'm sure it's probably been addressed, but I really feel like it's something that really, maybe not so much in the Logan area, but definitely in the Mason County area, that we need somebody, or I'm hoping that it'll be, I mean, I want to have somebody at a local facility in Havana that can help these people fill out these forms and help them to get the health insurance that they need to get the treatment that they need. And then hopefully that's my second step, is taking them where they need to go. So, I mean, it's kind of a, you know, hand in hand, but I don't know if that's on your little, I can barely see it because I'm on my phone, but I just feel like, is that something that you do at this point?
No, that's really good, Shelley, because that is a barrier. Having a safe space for people to go to be able to fill out those type of applications, those type of getting on waiting lists, making those contacts. And so I hear that very clearly as a weakness of just having services available. I know that for certain services, let's just say someone needs, you know, a link card or a medical card, the DHS office is available for someone to go in. However, that's not always a pleasant experience for folks, or perhaps that could also be another avenue that, as you are kind of figuring out how you're going to serve in your community, I've found that going with them to, you know, if a medical card is the direction, going with them as an advocate to make sure to go.
Well, and right now the public aid office in Havana is not even open.
Correct.
So it's all done online, and you know, some of these people struggle with that. And I just want to be able to help them through that process and make it as seamless as possible so that they can go on, because people that have, you know, people that have mental health problems, they don't see an end in sight. And that's just another barrier for them to keep from getting help. And that's, you know.
Yeah.
So I think a thing to add could be the opportunity to connect people with additional support to get new benefits, or to, you know, or even partnering, could the build out be with the local community college if there is additional training or skill building and to improve literacy skills, as well as direct connection to that. So however you want to word that, Grace, opportunity.
There's a lot of shame though in that. There's a lot of shame for those people are not going to go to the college. Those people are not going to go to the college. I know these people, they're not going, you know, they are ashamed. I mean, they might be 25 or 35 years old and not know how to read or to write or to work a computer. And I just want to be able to, you know, and I think you're right, though, the community college is a fabulous place, but most of these people can't even imagine what a community college is. And I'm coming from, you know, a town, I grew up, it was 400 people. And there's just, well, let's just say it, there's such shame in mental illness, and they don't have they can't get the courage to do the things that they need to do.
Well, our hope, Shelley, is to think outside of the box, and so grabbing onto Nadia's idea of perhaps it's partnering with a college for the computer access, and to have peer support that would meet them there, or someone from your organization as you're building that out. Just having some neutral ideas of partners and different ways that we can build out this idea. But hearing you
I
loud
think
and
it's a great
clearly.
idea.
Yeah.
I would love to see that because, I mean, they're not going to be able to, I mean, if these people have no computer skills, they're not going to be able to, go forward. They're stuck, I mean, we're in a situation, we're in a lifestyle where you have to have those skills. So that would be a great thing. And we have a community college in Havana, which is great. So, and I feel like that maybe that would be I never really thought of that, but maybe that'll work. Maybe it'd be a good thought.
I look forward to brainstorm, and definitely we're gonna brainstorm. I'm looking, and I don't know how this hour just slips by like water in my fingers, but we are already 3 minutes out. I've left no room for folks to update. Siri's talking to me. So if you have any updates that we can share on your behalf, please email me so that I can share those. Our next ROSC meeting will be Thursday, October 19th, same time, same place. And thank you for spending your time with us. Shelley, I would love to, here's our contact information. I don't know if you can take a screenshot of that, Shelley. I would love for you to send me your contact information so I can follow up and we can have a good old time brainstorming and creating and visioning together. But I would love to do that with you and anyone else who is interested. Thank you for being a part of this group. Molly, I do want to make mention that Lincoln Memorial Hospital are these rock stars that are helping us get our items for our food for our recovery walk, and I will be getting with you when we're going to go get those. I'm waiting on that word, but wanted to shout out Lincoln Memorial and Molly stepping into that and helping us out there. Any questions, concerns, suggestions, ideas, please. Again, here's our contact information. We want to be available to you and continue to partner. So thank you for being here, y'all.
Shelley, if you need us to help you with any introductions of people, like I know you're in Mason County, but we are more than willing to help with like any sort of introductions to anyone you need to.
I appreciate that. I can't get on to where I need to be. I'm trying.
You're good.
You're good. I'm glad you found us, Shelley. I sincerely am.
I am very glad I found you too. It was the licensed clinical social worker in Havana. She's the one that gave me this information, and yeah, I feel.
Who is that?
Very. Hold on, I have her card in my billfold. Hold on, I'll tell you.
Okay.
I went in and spoke with her for a half an hour yesterday. Her name is Becky Hart.
I love Becky Hart.
Yes, Becky Hart is the one that gave me, because I told her what I was trying to do, and she said that you need to be in touch with these people, and I said, okay.
Good.
Awesome.
She's amazing.
She is amazing. I'm sorry I hogged up so much of the meeting. I just don't understand.
Don't worry about it.
No.